we're going to do a new case here. We're going to do an anterior case. So central incisor, we're going to plan this thing crown down. So what everybody wants to do now, so everybody should just go up and hit the big X in the folder. This is going to close our project. You can discard the save. Let's all get back to the start project window. And let's go through this one more time. So it's all about the repetition. Now we're going to do another case here to just get more experience. So you guys can follow along, watch what I do. We're going to move a little bit quicker since we've done this one time. But we're going to add a new aspect. So we're going to go into surgical guides. We're going to import our CT scan. And this time we're going to go and do... We're going to do the single central incisor. So it looks like there's a couple of them here. Let's choose the one that's modified January 28th. That's the one that we modified yesterday. So let's do single central incisor. So let's open up the CBCT for single central incisor. Yeah, the one with all the letters.
Single central incisor with all the letters on it.
So for those that are following, I'm cropping. All right, okay, so everybody's got their models in, we're aligned. We're gonna do setup now. So this one we're actually gonna put a tooth in there because we don't have a tooth. So we want to get over, we want to go into our module, we want to be in the advanced surgical guide module. And if we go into our surfaces, this is where I like to turn off the CT because this is just too much information going on. So under surfaces, we can uncheck the visibility. And I've actually got the wrong model in here as well. So I'm gonna, all right, so I've got the correct model here now. So I check my cuss tips, I'm all aligned, everything's lining up. My outline is lining up nicely on my teeth here. And now I wanna get a wax up. So we've got our green model here. I want to put a tooth in. So if everybody goes up to the plus and hits add tooth, we can pick any library we want. I really like this Mitch Hurst Ponic library. We're going to select number 9 and hit OK. And then we're going to shift click it right where we want it. So this is called doing the digital wax up. So we're looking at how we would want this tooth in this position. Obviously, this patient's occlusion's poor. Cool. All right, I'm gonna walk around. We're gonna make sure everyone's got teeth in here. Hey guys, we're gonna throw in the opposing. So everybody needs to bring in their opposing model because we're doing a tooth here. So let's go through the whole process. So if you go up to File and you go down to Import STL Model, let's go in and grab our lower one. So go into the same place where you opened your first case, and bring in the lower arch. Now, this is where we have to do something called model alignment directly from model to model. So check this out. We got our lower in here, and the lower is not aligned to the upper. It's not we haven't told the lower to go meet the upper in its original relationship. So this is where we use these other alignment tools. We want to tell the lower model, the lower scan, which is blue, so you got blue model, and we want to align it to another model. And so we want to align it to the green model. So if you've brought in your lower model, you can align it to the model. And you're going to say, which model do I want to align it to? Well, I want to align it to the green model, and you don't want to align it using points. So points would be common objects between the same two models. So if you had an upper meeting an upper and those cusp tips were identical, you'd choose points. We don't want to choose points in this case. We want to just align it directly. And now we get that relationship in which we scan the patient in. So we're telling that lower to go snap to the upper in its bite relationship using that alignment to model function. Let's go over the thought process between this case and doing a guide. So I've got my implant placed, prosthetically driven, and I look at that and I go, my guide tube is halfway into my tissue in this scenario. So if we printed out a sleeveless plastic guide, all we're going to get out of that is what's exposed over the tissue. So not enough, right? The tissue is impinging inside of our guide tube. So that's going to leave us a really thin wall of guide portion. We're not going to get that kind of control we want. So we've got 3 options in this case of how we can handle that situation. One is I could go edit the model and push the green down below, which that isn't the simplest way to do it, not the recommended way in this case. 2 would be I could plan this case for a metal sleeve, knowing that I could cement a metal sleeve inside of here, and it's going to grab those walls, and then the metal sleeve is going to become the whole guided portion, and it'll get out of the way when the tissue's flapped. Or the last thing, probably the one that I would choose, would be that increase that offset. And so I have in here planned a 13 millimeter implant. Yeah, I planned a 13 millimeter implant in here, okay? So I want to go and increase this guide tube. Now, let's talk about how much we want to increase that. If we were going sleeveless, remember we got to go to 8.5. What if we want to do sleeveless and increase the offset to the next drill? We've got to increase it the next drill length. So right now we had a 13 millimeter implant placed, right? Well, what's our next size drill up past 13? It's the 16, right? So if I wanted to stick with the blue sky drills and extend that up higher away, I can move to that 16 millimeter drill. So what do I have to add 3 millimeters to my offset? So in that case, I would take this from 8.5 to 11.5. Now I've got all this plastic that's going to be guiding my drill. So we went from 8.5 sleeveless and we bumped it up 3 millimeters to give us 11.5. And now we would take a 16 millimeter drill and hub it out. That's going to give us that proper depth. And then we would take our 13 millimeter implant and we would sink it through the guide tube to an offset of 11.5. Is that confusing? Cool.
I think that's kind of confusing initially. When you first start doing that, you gotta make sure you think through it and even make some notes on that. Those can be, now when you spin that, will it fill in, spin it so you can see sideways, will it fill underneath that?
Yes.
So the guide tube goes longer?
Yes.
It'll fill in down there?
Yes.
And the tube will extend down to the gums?
It will. It will.
Good, okay, I always wondered about that.
Yeah, it'll essentially increase the height. It'll do exactly what I'm doing right here, right?
Oh, you just made it, yeah. It'll just do that automatically.
It'll do that automatically. And
You
now,
have to change that height.
No, you don't have to change the height. It does it automatically. And now I get more plastic, more guide control. Now my guide locks in because I have more vertical height of engagement. So that would be how I would handle that case. I'd increase the offset, and I would use a longer drill than the implant that I am actually using.